Let your curiosity rise.
Mad Bricks webcast,
Where the human spirit flies. Mad Bricks webcast, where the human spirit flies.
Hey, welcome to the Medbix webcast. This is Ramana Namaraju. I'm the host. I'm in a transition a little bit. A lot of things are not in place. Sorry about that. If we didn't go as scheduled as perfectly scheduled as possible, but this happens, right? And that's yeah. I have a guest. I've been interviewing more than 2 3 years. More than 400 guests. Nobel laureates, powerful doctors, MD, PhDs, and the guest who is coming, a very distinguished guest. And before that, let me introduce you my good friend, Jill McMahon. I have always problem with your last name anyway. Jill McMahon. Jill McMahon, I think I said right. She is a good friend of mine. She is a trauma therapist. She is a she treats patients with the gun violence and other things. And she is a good friend of mine. Let me welcome Jill McMahon from Maine. Maine, I don't know. I thought she's from Scottsdale, Arizona. But welcome to Jill.
Well, hi, my friend. You are right. It's a little confusing. I'm in Maine right now for the summer, but I do home in Scottsdale, Arizona. I have the best of both worlds.
Yeah. I wanted to ask you, just to let me, I didn't introduce you proper, but tell me background of yours a little bit of minute. You're my co-host, but, just to let you know what you do.
So it is hard to put into words, Ramona. You're right. You and I have worked together in the past. I am a gun violence survivor, but as for profession, I am a grief and trauma specialist. I specialize in suicide postvention. So for over 20 years, I have worked with friends and family members that have lost a loved one to suicide. And now I am pivoting and doing gun violence support work as well. I've created a book for gun violence survivors. So rainbows and sunshine over here, my friend.
Rainbow sunshine. When you're talking about suicides, I didn't know this. Among the physicians, the suicide rate is one of the highest among the healthcare professionals. That's very surprising to me. It is. Let me, but that's one of our guests is can shed some light on it, and she's also knows how to run the business. I love women who loves to do business and make money and show the money. She's good at that. Anyway, let me introduce you my guest. Our guest tonight is dedicated a career to one medicine's greatest challenges, not simply helping patients live longer, but helping physicians build careers that are both professionally fulfilling and personally sustainable. It is my pleasure to welcome Dr. Jerina Gani. Jerina Gani. Actually, I want to tell you, Jill, we had a famous movie actress in India called Jerina Wahab. I loved
Mm.
her movie. She's from my hometown. Dr. Gani is an internal medicine physician and Beth Israel Deaconess Hospital Medical Center and a teaching affiliate of the Harvard Medical School. When she also serves as a clinical instructor for medicine with advanced training in health services management from the London School of Hygiene and Tropical Medicine. Oh my God. She combined a clinical excellence with the clear understanding of the healthcare systems beyond caring for patients, burnout, increase their income, achieve healthier work environment, life balance, all of that. She does everything. Let me welcome Dr. Jerina Gani. Dr. Gani, welcome.
Thank you for the great introduction. I'm impressed. And my name is your first name is Jerina, it's true, and I didn't know that in India that name exists. I was born in a small country in Europe called Albania, where Mother Teresa comes from. And Mother Teresa
Oh,
in Calcutta stayed in Calcutta for too long, but she was Albanian. And the funny thing is, when I started working in Boston 20 years ago, I've been working here for 20 years. I've been in the United States altogether for 30 years. And first I came in New York City, then I moved to Boston. And then one of the patients, when I started at that clinic, said to me, "Oh, that accent, where are you from?" And I said, "Well, I don't give it away easily. You have to guess that." And he was like, "Where are you from? This and that." And I said, "Well, if you cannot guess my country, why don't you tell me where Mother Teresa is from, because I'm from the same country." So she's like, "Oh, so she's from Calcutta. You must be Indian." I said, "No." He said,
yeah.
"No, it's Albania." So that was the connection with India, that I had at the time.
But they're
If you
different.
want to know a little bit about my background or anything else, I'll be happy to talk more.
I'm
You
going
want
to
me to
contest with
continue?
you. I'm going to contest with you about that. She took the Indian citizenship of Mother Teresa.
Yes,
So
she did.
she's
She did.
Indian.
And
So
I
she's
was
Indian
I
now.
was lucky enough once she came in Albania. She was, Albania was a socialist kind of communist country at the beginning. It was closed, so she couldn't even come to see her family there. But one
Wow.
time that she came, I was so lucky to give her flowers. I was chosen to give her flowers, so I
Oh,
met her,
really?
and you can see. I mean,
Oh,
this is not about Mother Teresa, but she was amazing. She was an amazing woman, right? And you can have goosebumps just touching her, hugging her. She
oh,
was
yeah.
amazing. A short woman, but very powerful. So
You
that was a
know,
story with Mother Teresa.
when she passed away, every president of the country in the world almost presented a funeral. I mean, a memorial
Mhm.
ceremony. She was a symbol of giving. President Reagan said that I'm giving a
Yeah.
gift, a golden gift, but she's going to sell this one and give it to the poor.
It's
so,
true. It's true.
so
She was
she
amazing.
does.
She was really
So
amazing. Yeah.
Albania is in the news nowadays.
Yeah, it is. I
Because
was there. I
well,
was
for
there.
good
They
or
were
bad, we don't
protesting
know.
there. I was there.
Albania is
So,
It
in.
so,
was
so you just came home. You just came back
I
from being
just came
home,
home on Sunday. Yeah, I was in
right?
Albania for 3 weeks. I was lucky. They gave me 3 weeks vacation, which is amazing. And I met
Mm-hmm.
friends and family, and it is becoming a touristic destination actually now. And
Mm.
we own a condo in south of Albania. It's a small town and very close to that Sazan Island they're mentioning in all the news. The protests
Yeah.
are about that island there, but it's a beautiful piece of the world. There's been discovered more lately because it was closed, so it's popular now.
How important for you that you're getting time away? I just heard you say, yes, you went home, but for 3 weeks. And I think, as being an American professional, we don't do that enough.
I agree.
Dr. Gani, we don't do that enough. And
I
you're
agree.
the role model. You're just setting the tempo for everybody else. Do it.
My dream is first of all was my dream for my own personal life to change my lifestyle because I was working like crazy. Primary care is so busy, and I work in primary
I
care
bet.
here in Boston, and we're kind of neighbors now because you're in Maine
We
at the
are.
moment, right? So we're not far from each other. Is a lot of in the shoulders of primary care providers, clinicians, including doctors and nurse practitioners now who are helping, and physician assistants. But we have to find a way to enjoy our life. And
Agreed.
when I came working as a doctor or trying to become a doctor again in New York City 30 years ago, when I moved from Europe, I wanted to become a doctor, but I didn't know what profession, to choose. To choose internal medicine or to choose a specialty later on. And I was going towards cardiology because I did cardiology research at NYU before I did my training in internal medicine. And at the end, honestly, they even offered me cardiology when I finished, because I did 4 years of research in cardiology.
Right.
So they called me then and they said, we would like to give you enough to offer you a cardiology, position here. Would you like? It was very hard. NYU was very competitive.
Mm-hmm.
Honestly, I turned it down because I liked primary care, believe it or not, as funny as it is. And one of the reasons, this is funny enough, one of the reasons that I turned it down was because while I was studying to become a doctor in New York City, and I had to do different jobs when you come because nobody cares. Who the hell are you? 2 degrees, who cares? You are nobody, you have to study. And I worked in different places. I worked as a waitress, and I was a bad waitress because I never worked as a waitress in my country. And then I did so many things, travel agency and this and that. But one of my most famous jobs that I loved so much was working at Bergdorf Goodman in Manhattan. That's a very fancy store next to Plaza Hotel, selling jewelry. I was selling jewelry there. And, honestly, these people were on commission and salary. And I had no clue when I got in that I just wanted a job because I was doing research at NYU and I was so tired with numbers all day. And I had to study at the end of the day for the exams. And the boards were very difficult when you study by yourself. You have no other help. My parents never wanted me to come all the way to America. It was my decision.
Mm-hmm.
I came by myself,
Mm-hmm.
single and young and doing this. And then I wanted something simple. And I see this beautiful store in Fifth Avenue. And I said, I'm going to go there. I'm going to try to apply. And it was very hard to get in. But finally, I got in.
Where is this located? Where is this
It's
located?
right next to Plaza Hotel.
Plaza
Bergdorf
Hotel.
Goodman is
I used to live
considered
in New York.
Yeah, it's in Manhattan. It's right next to Plaza, in front of the Tiffany. Tiffany is on the other side. I mean, Bergdorf Goodman has 2 stores, has men's store and women's store. So all the richest people in the world go there. So imagine, that's why I have this. This is real jewelry, I got that there as gifts, when I was working there. I love to wear it mostly at home because at work, I cannot wear it with a stethoscope. I don't want to mess it up. Or when I go out, so it's funny. And it was the most glamorous job I ever had. Because first of all, for 2 things. First of all, I didn't know that these people, and sorry, I'm going far from medicine, but I'll talk about medicine later on. But all this shapes our life. All these other jobs.
It always comes together. Right.
It comes together, exactly. And then, you go there, and then I started to work, and I had no clue they were making so much money. We're talking back in 2000, right? So they were on commission and salary. So salespeople at Bergdorf Goodman were making from $150,000 to $200,000 yearly
Oh my
salary.
goodness.
Can you imagine that? So I was doing research at NYU, and at the time, $35,000 in
Wow.
research was a good salary. You're not doing research
I
in
need to
NYU.
quit my job.
I'm telling you.
I'm giving up
So
my
I
private
end up
practice right
there.
now.
I end up there, right? And I'm starting to become a doctor. And these people are making so much money. They were making fun of me in a nice way. Hey, doc, you're going back to medicine. What's the matter with you? Look at how beautiful it's here.
Right.
And that job not only was beautiful, 7 floors. That store is gorgeous with chandeliers and security and all these 7 floors, right? But jewelry, they were asking us to wear the jewelry pieces every day. So you choose to
Wow.
wear a $50,000 or $100,000, and you cannot afford $1,000, but you can wear all these expensive things all day. 7 floors, and you can walk with that 7 floors as long as you're within that place. So you feel like a millionaire. You feel so
Right.
so smart and beautiful. You have to dress up nice. And I was like, they just smile and they sell and they make so much money. And I'm trying to become a doctor tomorrow. I'm
Right.
studying and working so hard, and you know how residency, when you start residency, which was so hard to get into residency, you start
Right.
with maybe $40,000 a year was, I
Right.
think, the first year of internal medicine at the time, back in 2004. We're talking about 2004 when I started residency. So after 2 years there, I finished my board exams and I stayed 1 more year. My parents
Oh,
from
good for
Europe were like, you have to go back. You're a doctor. You're not a salesperson. That's the way they think in Europe. I'm like, no,
Good for
you cannot
you.
talk to me like that. I'm going to stay another year because I'm never going to have this job again. And I wanted
Good
to
for
go to
you.
medicine.
I
Yeah,
want
I
to say
wanted to go to
something,
medicine.
Dave.
I'm
Dr.
sorry.
Gani, I want to say, sorry to interrupt you, but I want to say something important here.
Yeah.
That, like I'm in Silicon Valley. In
Yes.
Silicon Valley, I used to,
Wealthy place.
I used to live in Atlanta. I used to place doctors, on a J1 visa. Particularly J1 visa is one of the prominent visas for a lot of foreigners. Doctors come there, and I need to take them to rural areas and place them on a J1 visa. I used to get doctors from the New York City, Beth Israel, and Brooklyn Hospital, and all of those places.
Yeah. Mhm.
Then I was during this same time, the Y2K project came in. I was placing computer programmers. You know how much I'm paying twice to the computer programmer. He learned 3 months in India or some other places. The course, he took a 3 months course, and I was paying twice the money as a cardiologist.
Wow.
Can you
Yeah,
believe
you
that or
see?
not?
Yeah.
It is just
Yep.
crazy world
Yeah.
we are in.
And I agree. And going back to cardiology, I didn't want to go to cardiology because I said I have to train for another 4 years with minimal salary
Yeah.
when I can just
Yeah.
start now primary care and enjoy my life different ways. So I always, in back on my mind, I thought I have to find ways to work as a doctor, but if I have some extra time to do other things I like. That was in back. Bergdorf Goodman changed that. That store changed my attitude toward medicine and everything. It helped, it shaped me, helped me, because I realized people can make a lot of money differently. And strangely enough, many doctors, even today, they think that they're so important because they are medical doctors. And honestly, sometimes I don't even like the fact that some doctors don't treat nurse practitioners or physician assistants nicely because they think, oh, they're not knowledgeable enough. It doesn't have
Right.
to do it that way. I think for the knowledge, you have that MD after you, so you know a lot. You have studied so much. Nobody will take that away from you. But it's good to be a good person, even with patients. What I noticed from the success I have with
Beautiful.
my patients is the fact that I'm not Harvard graduated. I didn't finish Harvard. I worked there, but they appreciate and they enjoy. They're so faithful to me and they love me and I love them because I'm real. And I tell
Yeah.
them, if I don't know anything, I've been 20 years as a doctor, and you can never know enough medicine. You all know. I mean, you're always learning more and more and more. If you don't learn, then you're not good enough as a doctor, anything. So if I don't remember anything, even when I was a young doctor there, if I didn't know anything, I would say, oh, I'm going to look up into that. I haven't noticed this or I haven't known that. And they appreciate that. You don't have to go on the back or hiding and come back. And because some doctors were doing that when I started, not here, but in other places, because I have people, I have friends everywhere. They were like, excuse me, they were leaving the room, going to another room, Googling something and coming back. the patient figures that out. They figure out that you're not
Really
answering
quick.
right there, when you
Really,
just start,
right,
because you're
right,
nervous, you don't know things, right? You don't have to do that. If you don't know anything, you say, you know what? Let me just look this up. Be real.
right,
Look this up because
right.
this particular thing, I don't know. And they don't mind if you learn more, but they want you to listen to them. I think if you listen to them, that's the most important thing. If you make time to hear them, they love it because they know that you're going to care about them. That's my opinion. That's a success in medicine. Now, to reach that point, you have to have some time when you see them because most of people have now doctors or whatever,
Right,
15 minutes is a joke.
right.
What are you going to do in 15 minutes? It takes 5 minutes for a patient to come to the room. The medical assistant had to, as you all know, because all of us are patients somewhere. Even, everybody's a patient somewhere. So you have seen it. It takes 5 minutes to go into the room. So what is left for the clinician, the doctor?
Hmm.
10 minutes? That's a joke. What are you going to,
Hmm.
just one problem you can discuss? But they come with many problems. And I figured
Right.
that out even before when I was working. I said to myself, they cannot come again because they're busy people. They have to leave a
Hmm.
babysitter home with their children to come to make an appointment to see the doctor. And so they cannot keep coming. I never did that. I never told them, okay, one problem or two problems today and come back. No. If they had a list, I would try as much as I could to discuss the problems. And I'll say, well, this much time we have, let's do as much as we can. And then I said to myself, time is a problem. I need more time.
Hmm.
And then I asked people that I worked, I said, how can I do, we never had 15 minutes appointments, let's face it. We had 20 minutes, but even 20 minutes wasn't enough. So I said, can I do 30 minutes? 30
Hmm.
minutes at the beginning were only for people who came for a physical exam. But, people may have many problems. They don't have to come just for a physical, and you can still discuss everything in 30 minutes. So I was lucky enough to be approved by them to do 30 minutes visits. And imagine we are RVU
Wow.
based. So if you're RVU based, they will think whatever you make, whatever you produce, you make in a way, So
Right.
if you see patients every 30 minutes, you cannot see more than 16 patients in an 8 hours. That's all I'm seeing now,
Right.
16 patients.
Right.
So your salary would drop at the beginning because they will calculate and they'll say, okay, you're not seeing 22. I was seeing 22 patients before every 20 minutes. Now seeing patients every 30 minutes. So your salary would drop. I said, okay, but they calculated every 6 months. So you know what I realized? The success was this. Well, not only that I had success with patients because I had more time to deal with each one of them, but I was making more money because now I was discussing more issues with them. I was billing better and I was getting reimbursed better.
Mm.
So it worked in both. So to my opinion, when doctors think that they have to see 30 patients a day to make money, they're wrong. They're wrong. Not only that they're killing themselves, they're so burned out. And I'm doing some reels on Instagram and I'm on YouTube and everywhere. I'm trying myself. I'm trying to go out there and to express my opinions on this. And one of the things I said recently is that now clinicians, not only that they're burned out, but they're losing themselves in the process. And losing themselves means you don't count your desires anymore. You don't have time for yourself. You're just a people pleaser. Yes, 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 and move on because you cannot survive. So this is not good. This is not good because if not yourself, if you're not enjoying your life or trying the best you can with your life, how can you serve other people? How can you help other people?
Dr. Gani, that is a point I wanted to just talk with you. Jim is
Yes.
a counselor, so, you know, uh, New York was the epicenter of COVID-19.
Yes.
Were you practicing during that time?
Yes, I was. It
Must
was
be.
very, very
So tell
difficult.
me the scenario, the grief, the chaos went through, and
Mhm.
then people are stunned in the world what they saw in New York. Can you describe that scene and how you, as a physician, dealt with that stress?
To tell the truth,
Great
it was
question.
very, very hard. And at that time, I was working full time because I started
Hmm.
working part time the last 5 years now, from 2021 to now. So it was after COVID. During the time I was working full time, it was a nightmare because on
Hmm.
top of all this hard work we're dealing with this uncertainty of COVID, people getting sick. You don't know who is getting in your room and how sick they are. And it was, I think that what I heard and what I heard from my colleagues, many people either retired early or left medicine because I couldn't handle it anymore
Right.
after COVID. COVID was like the end of it, it was very difficult. But some people after COVID realized that you have to work less, you have to get less burnout if possible. And one of these people was myself. I realized if I wanted to survive, I have to do something about myself.
Do you think
Because
that was the
that's
silver lining of your COVID experience of being in the
I
epicenter?
think
Was
that was one of the major issues because COVID-19 time, these 2 years, it was about 2 years that we're going through such a
yeah,
hard time. We had patients who were dying, we had patients who were very sick, and we were scared, all of us. We
right,
didn't know what to do. We're working because some of physicians or clinicians who couldn't work because if you are discovered with COVID, you couldn't come to
right,
see patients. So other people were, and I never got sick during that time, like sick to go home. So I was exhausted. I was working more because you
mhm,
have to cover for other people, who were not
right,
there. And even if they didn't have much symptoms, they had to be home for that quarantine time. So it was very difficult. And I don't think we had televisit at that time. We couldn't do much televisit. We had to do in-person visit with patients. Televisit came after, maybe the second year, they realized that we had to have, which was a big help. But at that time we didn't. So it was really very, very difficult. Very difficult.
I was reading something, Dr. Gani, that stated that how prevalent burnout is in the medical profession, and of course, in 2021, where was the highest rate ever recorded of burnout. But it has gone down in the last few years, which is great. But it's still, I mean, I think the statistic I read, it was a Stanford study that was released in 2024. The sample size was like 7,600 clinicians. I would have loved to see the sample size a little bigger, but was that physicians are 82% more likely to experience burnout than other occupations in this country.
And
That number in and of itself is ginormous,
so
right? I
much.
mean, we're not even talking pandemic. So if it's 82% in 2024, can you imagine in
During
21, in
pandemic. Yeah.
22, right? We
Mhm.
I think your profession felt the long-term effects, to your point, of
Yes.
the pandemic, right? You started thinning out. Some people left your profession. You
Yeah.
were all burnt out, fatigued, couldn't, wow,
Exhausted. And at that time, right
exhausted.
after that, around, yeah, by the end of 21 or I think beginning of 22, I decided to move to part-time. And I said,
Yeah,
I will take the cut in my salary. I never, I
yeah,
didn't know. I knew that I would do okay, but I didn't know that I would do better financially by cutting
yeah.
back. That was the funny part because that was my experience. I said, okay, even if I cut back, my health comes first. I'm going to do this. But then when I noticed in 6 months, in a year, my salary was even better than full time. And I'm now working
And
part time
what do you
still.
attribute that to? I really am curious because now you're
So,
getting into the meat of what I do for a
yeah,
living, right? The
yeah,
self wellness really does pay off. But you and
exactly.
I are really in these fields where we carry other people's struggles, pains,
Burden. Mhm.
desperation, burdens every single
Yes.
day. So we are oftentimes not the first people that will seek self care, even
Mhm.
though because we're giving it instead.
Yes.
What how what do you think the turnaround was for you, that you could go to part-time
Mhm.
and become as successful, if not more? What do you attribute that to? I'm so
I
curious.
think I had more energy for myself because I organized my life better. So I decided to work
Mm,
3 days only. I work in the office. I see patients Monday, Wednesday, and Friday.
okay.
Tuesday, Thursday, I do not see patients. I still kept the 2,000 patients I had. I had a full time, I was working full time. I had 2,000 patients. I kept all of them
Okay.
because I felt bad. It's so hard for them to get another doctor
Right.
in primary care.
Right.
So I said, oh, I know them now for so many years, over 15 years,
You have a
16 years.
relationship with them.
Yeah, I love that relationship. And it becomes a family relationship. You have the
Yeah.
grandparents and you have the parents and you have their children too, because they all came. So I love
Beautiful.
that's the thing that I keep. I love that part. And so now I have more. So I don't do quantity. I don't do 22 patients. I do 16 patients. And for every patient, I can cut every problem they have. I can discuss every problem they have. I'm most of problems. I
Mhm.
mean, you still don't have enough. 30 minutes is not uh, 2 hours, but still it's much better than what it was.
It is.
And I can
Agree.
connect with them. And I am more, plus, now that I have time in between, I can prepare myself better. Because even before,
There you
my
go.
point was always to make sure that I review the notes of the day before. I'm totally booked. I know what I have for months, especially the day before. So the day before, I
Dr.
always check my schedule and see who is coming. But I can prepare myself. I know what they have,
Hmm.
what problems they have. So even if they forget to tell me something, I remind myself and I remind them.
Mm,
What about this?
Doc-
Did you do this? Did you do that? And this is better care for them.
I
So I
Dr.
agree.
don't miss
Gani,
anything,
yeah.
and they love it because they know that I know everything about them.
Hmm.
Plus, I have these moments because when you're exhausted and overwhelmed, because medicine is overwhelming, it's so many disease, illness, blah blah, blah, all this, that we deal all day. But when I have these moments in between to ask about their personal life, that's a moment they love it, and I love it too because it's a break for me. For example,
Right.
oh, you had this wedding for your daughter. Show me some pictures. I have time to tell them that. 5 minutes, 2 minutes. I will see those pictures. She will be happy, my patients, and I'll be happy too. And this is
Dr. Gani,
primary care. You can do all this
yeah.
in primary care. You can enjoy your day. It's not, you don't have to be exhausted all the time, but you can
Dr.
enjoy your
Gani,
day. Yes.
I, I wanted to ask you this one. You're talking about sadness, and both you're related to this kind of thing. I was just talking with the Jill about this, about the technology pressure,
Mhm.
technology documentation, clicking the buttons. It is it is indirect pressure on not only now on the patients and the entire population now, entire world probably. This
That's
is
true.
really becoming a serious disease, kind of a,
Mhm.
we need to almost come to a diagnosis problem, this is. So what do you think of this technology pressure? How do you contain ourselves? How do you, I go through that deep end even myself when I spend so much time. Maybe Jill can give some answers to us. But this technology, how do you deal with as a physician, clicking all the times, not seeing the patient, and writing all the notes and
It's
notes,
true.
completing
It's
notes?
true.
How
Is
do
a
you
lot.
manage that?
Yeah,
And
is a lot of
Jill can
pressure.
also
Is a
answer
lot of
that.
pressure for us. That's why we have to be very organized. We have to organize our time very, very well. I prepare my note the day before. I know what I'm going to get. I use templates and I dictate. So there are all these other things. This technology is difficult for some things, but we have some resources to use if we want to. And if we have our own routine of doing things, plus if you are disorganized, because we get like so many emails all day, phone calls from
Hmm.
patients. I said, if you keep getting disconnected or disrupted all day, answering them one by one, you'll never be organized. You're never going to be successful and finish. You have to be organized. You have to do them
Uh,
I do them in bunches. Okay, this time
Organization
of
is
the
the
day
one.
and that time of the day. I'm sorry.
Organization is definitely one of the things. Jill, let me ask you, what are the other things that technology can cause this humongous pressure on people that in then I give you my opinion, maybe you agree or both agree or not, but the technology pressure is that, what do you think from your point of view, besides organizing very well, that could be even it eventually end up in OCD if you two organize very well. So tell me, tell me your opinion on that technology,
You know,
how we can
I think
address as a nation.
I think that we're seeing pressure, technology pressure, especially in the clinical and the medical fields everywhere, in many different ways. As Dr. Gani was saying, we can use it to organize us. It actually can be very helpful. I now, in my clinical world, you go into a session with a therapist and they ask you permission if they can have it transcribed right then and there. That means I'm not sitting there taking notes, right? That means I'm looking at you in the eye and I'm connected with you. You can get deeper with me in the short amount of time that I have to learn your whole life story before I have to move on to the next person. It's the same as Dr. Gani, your 20 minutes, right? So
Yeah,
it can be helpful in some ways. However, it is also creating a disconnect because not everybody in a clinical setting, if that's in a medical office or, in my counseling office, um, can utilize their technology in a way that doesn't create a disconnect with the person that's sitting right in front of them. I think you have two exceptions to the rule on the screen right here because we know how important it is to be present with our people. The flip side of that, Ramana, is a lot of people that are coming in, I'm assuming, um, Dr. Honey would agree with me, that are coming in to see us have already used technology to
Yes,
diagnose themselves,
that's
right?
right.
So, and that's right, wrong, and otherwise. They've done a lot of research. They've come in, and maybe what could be a minor infection in their minds now is most certainly terminal cancer, right?
Exactly.
And
It's
so
true.
they've now spun themselves into this web, and they've created this anxiety that when they come in, they're bursting, right? They have to share, they need assistance right now. Aren't you going to do more tests? No, Jill, you can't just send me off on my way. I'm pretty sure that I'm not going to make it in here to see you in 2 weeks because I know that I'm going to be dead, right? So
Mhm.
that is to me, another detriment and or pressure that we are dealing with when it comes to technology, right? I will tell you in my room, um, the amount of anxiety that I see sitting on my blue couch that did not exist before 2006 when smartphones were placed in our hands. It's unsurmountable. So, right, we're having psychological, physiological symptoms that are increasing because of pressures, because of constantly being connected. That's why I love this conversation because I think Dr. Gani is such a model. I mean, she's already said two things that I'm holding on to really tightly. Like, she reprioritized her life to give herself time back. And she also said early on at the beginning of this hour that her patients just want to be heard. And
Yes.
she recognizes that. That's how we connect, right? If we connect with ourselves, we can connect with others. That's taking time off. And
Mhm.
we need our patients to set the technology down a little bit. We need to reconnect in our interface so that we can all create a rapport and connection because I could go on and on because
I want
I
to
disconnection
agree.
can create disease,
I
right?
agree,
both.
but you know what I think else? Like you have to have a relation with a patient so they can trust you enough. And even when they're scared, and when you calm them down, you talk to them, they trust you. It cannot be with one
Yes.
visit. That's the beauty of
But,
primary care.
but
They keep
but let
seeing
me.
us again and again and again.
Hmm.
And if you trust your primary care doctor, they come. Many people come anxious. I
Oh,
know it.
sure.
Some of them are anxious by nature, and then plus they read all this. And the people who are more anxious, they read more because they want to feel secure and they get more anxious. It happens. So
Dr.
if they
Gani,
know you
you,
as in primary care, I'm sorry?
Dr. Gani, you and Jill, I take a different take on this one, and adding to you what you all say, I
Uh-huh.
think there must be. I'm in Silicon Valley. Apple is a very few miles from here,
Yeah.
and then LinkedIn, and then you Google and Facebook,
Uh-huh.
all of them here.
Yeah.
What they have a lot of competition. In this competition, they
Mhm.
will putting these consumers in tremendous amount of pressure because they don't want to connect with them each other. They give so there is no congress oversight on this. How much causing this trouble to the public? People like you, doctors like you, and
Mhm.
psychologists, therapists like Jill must raise their voices about this. These companies cannot get away without any hearing. There is no have they done any research studies on it, any clinical trials on these pressures? There is nothing there. They're unhinged, unopposed, whatever they want to do it. It is unbelievably that aristocratic system. We used to be theocratic system like a religious. Now we have a
Mhm.
technocratic system. We have
Mhm.
they are
This is true.
Mm.
controlling us in a way that we cannot imagine.
But I'm not afraid of them bringing all the information there. It's good for them to bring. I don't mind it. It's a challenge. I see it as a challenge. It's so exciting, when they come and they think, "Oh, I may have cancer. I may have this." We had that issue as medical students in the first year. we read something and we're like, oh my God, I have this. I have. So they feel that way,
Yeah.
that much knowledge they have, and they feel, oh, I have this. So if that's why they come to us. So that doesn't scare me. I know that they have so much knowledge now, and some of that could be wrong, some would be right, but I'm not scared. I think is a period. Is like a period of this. Everybody, all humanity will go through this. They will get all this knowledge, and some would be right, some would be wrong, till they figure out what it is. But if I compare this year with, let's say, 3-4 years before, I think that now patients have more access to even good knowledge, not only scary knowledge, because the knowledge is there. I see it myself sometimes. I even Google and ask a question like I am a patient, what the Google will tell me, or what ChatGPT, whatever. And I see that some of the information is correct, or most of the information is correct. So it's not that bad. Before it was more messy. They would hear just one thing and that's it. So we shouldn't be scared of that, I think. It's okay. It's
No, I'm not, I love technology. I born in
yeah.
technology kind of world. Because we are talking all of us here through technology. It doesn't mean food is nice. I love Albanian food. I will love Indian
Yeah,
food. I
it's
love
interesting.
Turkish food. So it doesn't mean that I overeat anything, right? If I overeat, I die. If I eat steak every day, 24-ounce steak, I will die.
You're right.
So
It's not good.
over moderation is a more critical there rather than just loving and offering. Oh, that's because it's nice. We need to have some boundaries for all these
Yes.
processes around us.
Yes,
That's
it's true.
the
Everything
point.
has to be with boundaries. But
Let me change the topic a little bit for you. You said
yes.
that you're going to increase the. I used to sell medical devices for my living. I did X-rays, ultrasounds, and I did MRI, CT scan, PET. I did sell everything you can imagine. I used to set up clinics like your clinics,
Mhm.
all over the country. So one of the thing is I used to think one of the thing at that time technology is that benefit of technology. One area I saw is the primary care can offer a lot more than in some primary care. Even in Silicon Valley, you will be surprised they don't have EKG machines. Some of the primary care
Wow.
doctors,
Wow.
so they can do. You can bring in neurology, cardiology, cancer screening, and all of them they can do. Bring it to the primary care. They can make more money. In fact, insurance companies save money because they don't need to send it to the hospital, or
It's
hospitals
true
or
because it's
trials.
more expensive. I agree.
Too
I'm internal
expensive.
medicine. I finished internal medicine, so cardiology is my piece of cake. I do more cardiology, I do more GI because you learn so much. Reading all the notes of specialists too, and you're doing it every day. So primary care can see so many variety of disease and can do it right there before sending it to a specialist. And
Yeah, you can.
even the
Not
clinic
only
would be more
that,
profitable. I agree.
Dr. Gani, not only that, you have a computer technology, internet. Suppose you have a question on stress report or heart monitor. If you are
Yes.
not sure about it, you can always one click, you can send it to cardiologist. Hey, can you look at this? And then you can get
Yes.
back results back. You don't have to
Yes.
send the patients all over the place. Go here, go there, go to this cancers.
Yes, it's
All
true.
of
It's
them,
true.
or 90% of them,
It's
rule out
better
can
now.
be at the primary care level.
Mhm.
Primary care is the key. I think the world must recognize that it is the center of the epicenter of the healthcare system. We must promote that, and the primary care means people like Jill also involved, because mental health
Yes.
became
Yes.
such a powerful component in this whole process. I think people like Jill has to be part of that care system in the
I
primary care.
totally agree because we need so much help with trauma. We need help with psychiatry. We need help with all these things in primary care because we see these people and we don't have enough specialists. We don't have enough. We don't
There
have
you
enough
go.
psychiatrists. We don't have enough trauma specialists to help us.
Yeah.
If
Dr.
they
Gani,
organize it, it will be amazing. I'm sorry?
that was going to be my next question. As a primary care specialist, I will tell you that I have noticed that a lot of people are trending away from primary care and just have a list of specialists that they see. So, if that were the case, what do you think they're missing out on? Right? If I don't have a primary care physician and I'm already hearing, like, I want that connection. I want a you in my life that knows me and knows my family that I don't have to start over with every time. But what I've noticed is in 2026, there's a pattern where people don't have primary care anymore. They go immediately to the cardiologist or the endocrinologist.
I think primary care is very important, not because I'm in it, but a primary care doctor will see the full picture. A specialist will see, I have noticed it with specialists. For example, they deal with the heart. And if the patient has some
Right.
problem with blood pressure, they concentrate so much on that without thinking of other issues that the patient can have. Primary care will see we see the heart, we'll see the lung, we'll see the kidney, we see the anxiety that is connected with this.
Mm-hmm.
Because many times that palpitations, anxiety is, palpitation is anxiety related. It's not, it doesn't have to do with the
Right.
heart. Many
Right.
times, depression causes a lot of other issues many times before. And this
It does.
primary care can see that. Primary care can see it right there because we know the patient. We have seen this patient so many times. As soon as they get into the room, we can tell. Because it's not only the numbers, it's not only the heart rate of 200.
Right.
Is the anxiety, is a panic attack, she's having it right there, I can tell, And so that's why primary care is so important.
I wanted to highlight that. I just wanted to hear you say it because I don't want people to forego primary care because I believe it is so important as well. It's the full body, it's seeing the whole person. And I love the work that you are doing, not only what I'm hearing with your patients, right? You have found a balance in your life that creates a better you, which then brings the better physician into the room. You're allowing more time for your patients. But I don't think what a lot of people know that are viewing this episode today is the work that you do with other physicians around burnout, right?
That's
The
right.
voice that you have. So can you, I know that we're, 45 minutes in.
Yeah.
I don't want the whole hour to go by without you talking about your passion and your work with physician burnout.
Thank you,
Very
because it's my favorite part is to make a difference in primary care. For physicians in primary care, I'm talking mostly because we are so burned out. They work so much, work. Everything is dumped on primary care. Patients go to emergency room, everything is done to them. You have to see it. Don't forget to see this. And you have no room when to see the patient the next day. And they tell the patient when they go to emergency room, you want to see your primary care has no opening, what to do.
Right.
So it's so much in primary care. And I don't want doctors in primary care to feel so burnt out and work so hard. So my dream is to change primary care in a way that these doctors in primary care to really enjoy primary care, to enjoy it financially and to enjoy emotionally. You can enjoy. I created an online course for this. I have created a course, Cracking the Code of Earning More While Working Less in Primary Care. I have a website, drganisecret.com. I have a website. I have created all these, and I've talked to doctors, and I try to help them as much as I can to understand that it's so important to every day, every year of your life is so important. You don't have to wait till retirement to enjoy your life. You can enjoy your life even working in primary care. Many of them don't believe me. Honestly, at the beginning, they don't believe me that this could exist because they think, oh, that cannot be. How could it be? No. And
they've only ever done it one way their entire career.
Exactly.
They've only ever known it one way.
Yeah.
Right.
They don't realize that, quality beats quantity. If you see less patients, that quality of the life for you and for the patient will be better. I mean, you know what I do? I see 16 patients, and I choose the last patient, and I stay longer with that patient. And that patient is entitled, but I enjoy too, entitled to tell me about her traveling or about any special thing that she did extra. That's my extra time, but I enjoy that part. I enjoy that so much. Like, I feel like she's in my living room and I'm having a cappuccino with her. Yeah. And it's so wonderful for both sides. This is the human connection. You can do this in primary care because that patient is not that sick. I'm not fine. If the patient is so sick, I'm not going to do that. But if the patient comes for just follow up or physical, I can do that. And it's a wonderful feeling. You can do this. And some people don't believe that I can do that. Yeah, I can do that. I enjoy that part. I can stay longer. I don't mind. I stay till 6:00. I stay half an hour extra, but I really enjoy it. And for that patient is $1 million moment. They enjoy so much. My doctor who talked to me about other things. Oh my God, I'm a human being too. And maybe working at work helped me. Doing sales is helping me doing that. Honestly, that helped me connect with people and do it.
What do those moments give to you? What can you tell other physicians about what those moments give to you?
I can tell you this. I feel so refreshed. I feel so energetic. Sometimes I tell story about my life to that patient, oh, this
Yeah.
happened to me. Like sometimes I have new generation, new people, the granddaughters of these patients. I have patients in their
Yeah.
80s and 90s, and I have the granddaughters, right? And the granddaughter doesn't know where she's gonna go. She finished college and she doesn't know. And so I remember one case, and I said to her, listen, if you are that excited, you want to do something, go to New York City. I lived in New York City for 14 years. I know New York City is the place to be for you. And I tell them my story, how I got to Bergdorf Goodman or how I did this. Oh my God, Dr. Gani, you really did that? Yeah, I say I did that. So these moments are, inspirational to them. Or sometimes I hear inspiring story from them, inspiring
Yeah.
story about their life. We learn so much because the beauty of America is that we see people from all over the world. Like
Hmm.
Mr. Amana said before, we see people from India. I have patients from India, from Laos, from Cambodia, from Thailand, from South America, from Africa, from everywhere, and Americans. But all Americans come from somewhere else, with generations.
Right.
So it is a pleasure. And I remember talking to a doctor like a few months ago, and I was talking to him about primary care. He did primary care in his country, I think in Africa, and he was studying now to become a doctor here. He was unifying his diploma, and he said that everybody's pressuring me to go through specialty. What do you think? I said,
Mm.
no, if you love primary care, go to primary care. If you
Yeah.
enjoy your patients in your country, you enjoy them a lot more here because you see people from all over the world. Honestly, I enjoy this more than anywhere else. I worked in Albania only for a year as a doctor because you finish very early there. But here, I enjoy so much because now, for example, I'm seeing a patient from Africa. The next one comes from Asia. And then the next one is American. It's so amazing. You were like seeing the whole world in one day. Isn't that amazing?
You're reinvigorated with your patients. I
I
Yeah.
can
love
hear
it. I love it.
you're getting to connect with them. And
Yeah.
again, you're modeling for other physicians that that's possible, right? If you just take a breath, pause,
Yes.
spend more time, you can reconnect. Like you sound to me, you and I suspect you're not 29. I am not 29 either,
Of course. Of
but
I,
course.
I
oh my
remember
God, I never thought
none
that.
of us are, you guys. None of us
No,
are.
You're
I
no.
only
remember what it
25.
felt
Oh my
like. I
God.
remember what it felt like to be a new clinician and
Yes.
how invigorating that was and how exciting that was and how I really believed that I could change the world. And I hear some of that energy in you because you've figured out a way to bring it back.
Exactly. I
Yeah.
agree. Exactly. Like when you start and you become a doctor, you're like, oh my God, I'm so excited. I'm a doctor now. I can
Yeah.
work in clinic. And then after that, it dies when you work so much and you
Yeah.
burn out. You have no energy for
Yeah.
anything. The last
Dr.
5 years, I
Gani,
feel so rejuvenated. I have that energy back. And plus now I have the knowledge. I have everything. So this is the best time of my life working as a doctor. I really enjoy it. Like imagine
Dr.
today I
Gani,
worked all day. And honestly, before I start talking to you, I was typing, I was dictating, I was doing my notes. So I worked all day. And do I look that tired to you? No. My day was
Dr.
more than eight
Gani,
No,
hours.
no, you
I
don't.
don't because I enjoy what I do. And if you enjoy
that,
what you do, you're not tired.
yeah, what you made an excellent point. I wrote an article recently in LinkedIn. It is called the Blue Dot Experiment. I said that I was talking with Jill actually. Rules exist to serve humanity. Humanity does not exist to serve rules. That's where the humans come in the picture. Without being a human, there is nothing, no medicine, no therapies, nothing.
I agree.
Humans are the key to understand. The, in my article, I scientifically proved that there is a limits for those rules that they cannot reach humans in that sense. Rules apply to some extent. We need people
Right.
like you, Dr. Gani, and Jill, my
Yeah.
good friend. We need to be humans like that, interacting like this. Is the power of the communication and
Hmm.
power of that human to human that is irreplaceable. Because the reason is we do not know exactly what is that consciousness is, what is the God's intentions are. Until that, we are stuck each other. So you and the Dr. Gani, you're doing that, putting the humans as the center is a paramount important, and also you're
I
giving a
agree. Oh,
strong
it's
message. Thank you so much. It is a truly an
a
honor and
pleasure.
talk with you, Jill. You're always pleasure. is always humanity brings to the front lines. And I love both of you. Thank you so much for joining with us. Anything you want to say? Final word. I'll give it to Dr. Jag and Dr. Gani.
I can tell you this. I enjoy so much our conversation with you today because we feel the same. We think the same. We feel the same. I can see that enthusiasm at Miss Mohan. I can see that you as to me. I think we are alike. And the beauty of life is dealing with people. If you have success in dealing with people, you're successful in everything you do. It doesn't, no matter how much knowledge you have. I mean, we have doctors who are neuroscientists. They could be excellent. And then the patient comes to me and says, I don't want to see that doctor. I don't want him to have surgery on me because he didn't talk to them. And, I go back and I say, well, he's a good neurosurgeon, so do the surgery and come and talk to me. That's fine. Do it with him. But because they don't communicate, they don't want to see that person. So communication is the key. It's not only good.
That is the missing.
The primary care, everybody has to realize it's not good only for the patient. They have done so many studies. They realize that people who give love or give things, they get happy too. They get, their hormones are better, the endorphins are better. Another thing that I wanted to say is hugging. I do a lot of hugging with my old patients, the old female patients. They're in their 80s, some or even 90s. Some of them live alone. I have it a routine at the end of the visit. I give them a hug. And I remember one day I forgot and I was busy maybe and I was going out and she's like, where are you going? And I said, maybe I forgot something. I said, well, I'm going to see other patient. She said, you forgot something. You forgot to hug me. So I went and hugged that old lady. That's wonderful, So that's a connection. That's primary care.
So both of you know more than I do. Human touch to touch is just a paramount. That is endorphins. There is a lot of research going on. To touch humans to human, touching and talking, communicating. All of them are paramount important. Stay on the phone. Our podcast is going to be over, but stay there, and I will talk with you in a few minutes for both of you. Thank you so much for joining. It's a truly an honor and privilege to have you, Jill. Thank you so much for saving me. Just joining and adding a beautiful conversation for this. Thank you all. Good night.
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.